The horse has a large tarsal angle of 160 degrees and has a relatively normal fetlock angle. Large tarsal angles have been associated with proximal suspensory desmopathy. It is important to recognize that a normal fetlock angle when standing does not preclude hyperextension during exercise, as seen in the image on the left, which can predispose to suspensory apparatus injury or be secondary to suspensory apparatus dysfunction. This horse is standing camped under in front and behind. If the horse is standing camped under behind, this will tend to decrease the hock angle, but the hock angle in this horse remains large. It again is at 160 degrees. In the horse on the far left, we have what I call the terrible triad. In this horse, the tuberous sacrali were considerably higher than the withers. We have a very large tarsal angle of 166 degrees. There was also hyperextension of the hind fetlocks. This horse had degenerative pathology of the suspensory apparatus. We also need to look at the alignment of the hind limbs. In the middle picture, we can see that a perpendicular bisector of the crus and tarsus is not in alignment with a perpendicular bisector of the metatarsal, pastern and foot regions. This is going to result in biomechanical overload in some of the distal limb joints. And in the horse on the right, we can see an extreme cow-hocked conformation, and this will result in abnormal asymmetrical loading of the distal limb joints. This horse has a base narrow hind limb stance, and as a consequence, in part, also did not load the metatarsal region in a vertical position. Rather like one of the previous horses, the hamstring muscles are not very well developed and not well functioning, and as a result, during loading, the left hind foot is rotating outwards and the hock is oscillating. It's very important to pay close attention to the shape of the hoof capsule, because the shape of the hoof capsule will be a reflection also of the shape of the distal phalanx and the way in which it is loaded. In this horse, we can see on the right that a line that bisects the pastern region does not bisect the hoof capsule. The distance B, the medial aspect of the foot, is smaller than that of A. Also note that the hoof capsule is more upright and has some degree of concavity on the medial side compared with the lateral side, highlighted by the large yellow arrow. We need to also look at the shape of the coronary band and the height of the coronary band laterally versus medially. In this horse, we have drawn a horizontal line which is parallel to the solar surface of the foot in the image on the left. And we can see that this line is not in contact with the coronary band on the right side, the lateral aspect, because the coronary band is higher on the lateral aspect compared with medially, as also observed when the foot was picked up in the right hand image. So lateral is to the left in that image.